Hey everyone, my name is Kristin Hertweck. I'm a resident physician at the University of South Florida. I'm here to talk about the second most common cause of non-traumatic death in high school athletes. There are between 240 to 300 deaths from this every single year. It's something that people don't typically think about. It's heat illness. I've called in a few friends to help me make this video. Our primary goal is to educate everyone about heat illness so we can prevent deaths in our school-age kids.
Let's discuss how you prevent heat illness. The first thing you need to do is to keep an eye out for the individuals that are at higher risk. They are kids who have had heat illness before, overweight or obese, recovering or currently having an illness, prepubescent, or kids taking medication for allergies, diuretics or water pills for possible water cutting, or medications for ADHD. Coaches and parents, to keep your kids safe, make sure they are drinking plenty of fluids before, during, and after any exercise. With pre-hydrating drink, at least 2 to 3 cups before practice or a game. The amount of fluids needed during the game depends on the person, intensity of exercise, and outside weather conditions. A good rule of thumb is for every pound lost, drink a half a liter of fluid. You can weigh yourself before and after play to get an estimate of how well you did replenishing your fluids. Another way to estimate your hydration status is to look at the color of your urine. It should be lightly colored and odorless. Keep in mind that the sensation of thirst is decreased during exercise, so you cannot necessarily trust your body to tell you when you're thirsty while working out. If you sweat heavily, then consider not only drinking more water, but eating a salty snack, like pretzels or pickles.
Athletes need to acclimate to the beginning of the season, as this is a high-risk time for heat illness. You should consider following the Corey Stringer Institute guidelines for easing into the heat. On the first 5 days of practices, there should only be one practice, lasting no longer than 3 hours. Equipment should be slowly increased, starting from helmets only, then slowly adding equipment until the 6th day, when athletes can wear full equipment. The same rule goes for contact. The first few days of practice should be non-contact, slowly adding some light contact until the 6th day, when athletes can participate in full contact practices.
Let's discuss the signs and symptoms of heat exhaustion and heat stroke. Heat exhaustion is the more mild form of the illness. Watch out for symptoms of headache, dizziness, nausea, vomiting, fatigue, and blurred vision. Typically, athletes with heat exhaustion feel tired, but are otherwise acting normally. These players need to get out of the heat, cool down, and hydrate with cold fluids. When they feel back to normal, they can re-enter the game. Heat stroke is life-threatening, and death occurs in 10 to 25% of these cases. An athlete with heat stroke often looks disoriented, confused, and acts weirdly. They may stagger or walk unusually. Sometimes, the player can wander off or fall into a coma. Core rectal temperature will usually be greater than 105 degrees. If those symptoms occur, the athlete must be removed from the hot environment and cooled immediately with any method available, and emergency medical services, EMS, should be called immediately. Cold water immersion as soon as possible is the best treatment while keeping the athlete's head above water. If cold water immersion is not available, you can use fans or ice packs on the groin, armpits, and torso. In a minute, we will demonstrate another nice method to cool down the player, the taco method. Cool the player to a temperature of 101.8 degrees, then immediately transport by emergency medical services to the nearest hospital.